Hi, my name is Rachel Harris and I'm one of the pharmacists that work at the New Brunswick Heart Centre. In this DVD segment, we will look at the different kinds of medications usually given to patients who have been diagnosed with coronary artery disease. It is important that you know what medications you are taking, why you are taking them, how you should take them, and what are some possible side effects. Once you have had a heart attack, you are at risk of having another one. In order to reduce your chances of having another heart attack and decrease the probability of your heart arteries forming new blockages, your healthcare team has advised you to make some lifestyle changes, such as increasing your physical activity, eating a heart-healthy diet, and other measures that we will talk about in the other DVD segments. Not only do you need to make the necessary changes for your heart health, but you will definitely need to take medications to reduce your chances of having another heart attack and decrease the probability or odds of developing new blockages in your coronary arteries. In most patients who have had a heart attack and have been diagnosed with coronary artery disease, up to 6 new medications can be prescribed when patients leave the hospital. The medications come from the following groups: antiplatelet medications, commonly known as blood thinners, cholesterol-lowering medications, heart rate-lowering medications, blood pressure-lowering medications, vasodilators, also known as nitroglycerin that relax the heart arteries, anticoagulants, also known as blood thinners, but these medications act in a different manner or way than antiplatelet medication. Each group of medication plays a different role in treating your coronary artery disease. Your doctor has prescribed your medications depending upon your unique needs, and the doses of your medications are specific to you. A few people may experience side effects from medications, but most people do not. All side effects should be reported to your healthcare provider, and your healthcare provider may be able to make suggestions that might be able to decrease or get rid of your side effects. At no time should you stop any medications on your own. The first group of medications that is important in treating coronary artery disease are called antiplatelet medications. Antiplatelet medications prevent blood clots from forming in your heart arteries and other blood vessels. They are used by doctors to prevent heart attacks and strokes. Antiplatelet medications work on the platelets in your body. Platelets are cells that stop bleeding in your body. We know that to cause a heart attack, a cholesterol plaque that has formed on the inside of your narrowed heart artery wall has broken open. Platelets and other materials rush to the site of the injury and try to repair the injured artery by forming a blood clot in the already narrowed artery. This can completely block the artery or partially block the artery. The blockage may be permanent or temporary. This blockage prevents the blood from flowing to your heart muscle, and damage to the heart muscle occurs. Antiplatelet medications prevent the platelets from sticking together and prevent blood clots from forming, thereby reducing your chances of having a heart attack. The most common antiplatelet medications are aspirin, clopidogrel, otherwise known as Plavix, ticlopidine, otherwise known as Ticlid, prasugrel, otherwise known as Effient, and ticagrelor, otherwise known as Brilinta. Depending upon your unique need, your doctor may prescribe aspirin along with another antiplatelet medication. This may be the case if you've had a stent or heart attack. You will be prescribed aspirin and one other antiplatelet medication to prevent your platelets from sticking to each other. Because your blood does not clot as well when taking antiplatelet medication, you may bruise more easily, and it may take longer to stop bleeding from minor cuts, injuries, or nosebleeds. The second group of medications that are used in the fight against coronary artery disease are cholesterol-lowering medications. The most common type of medication in this group is called the statins. Statins help to lower your bad cholesterol, known as your LDL, and slightly raise your good cholesterol, known as the HDL, in your bloodstream. We know that the coronary artery disease, fats, cholesterol, and other materials build up in the walls of your coronary arteries to form plaques. So over time, the coronary arteries can become narrowed with the plaques. When an artery becomes too narrowed, the blood flow is reduced through the heart artery and your heart muscle does not get enough oxygen. Much research has shown that statin medications reduce your chances of having another heart attack and decrease the probability of developing new blockages in your coronary arteries. These medications do this by decreasing the total amount of cholesterol in your arteries and by making the collections of cholesterol already there less likely to get inflamed and clot up with blood clots. The most common statin medications include atorvastatin, also known as Lipitor, pravastatin, also known as Pravachol, rosuvastatin, also known as Crestor, and simvastatin, also known as Zocor. The most common side effects that people may experience to the statin medications are muscle aches, muscle cramping, and muscle weakness. Because statins work in the liver, your healthcare provider will monitor your liver function through regular blood tests. There are other groups of cholesterol-lowering medications that your healthcare provider may prescribe. These medications work differently in your body, but most work to lower the various types of cholesterol in your bloodstream. These medications can include niacin, Ezetrol, or Lipidyl. The third group of medications used in the treatment of coronary artery disease are called beta blockers. Beta blockers work in several different ways. They slow your pulse rate and decrease how hard your heart has to work. As you learned earlier, with coronary artery disease, the coronary arteries narrow with plaque. When an artery becomes too narrowed, blood has trouble flowing through the artery. The heart muscle does not get enough blood and oxygen and you may experience angina. So by taking your beta blockers, your pulse will slow and in turn, your heart does not have to work as hard. Beta blockers also help to lower blood pressure, which is helpful in people that have hypertension. Beta blockers also help your heart to beat more regularly. Common beta blockers include atenolol, also known as Tenormin, bisoprolol, also known as Monocor, metoprolol, also known as Betaloc, and carvedilol, also known as Coreg. Some possible side effects that people may experience to their beta blockers include dizziness, lightheadedness, tiredness, cold hands and feet. The side effect of tiredness is frequently blamed on beta blockers, but in fact fatigue is a very common symptom following a heart attack or heart procedure. So if you experience fatigue or tiredness, discuss this with your healthcare provider, as the beta blocker may or may not be the cause of the fatigue. The fourth group of medications used to treat coronary artery disease are angiotensin converting enzyme inhibitors, or for short, ACE inhibitors. Like beta blockers, ACE inhibitors help your heart in several different ways. ACE inhibitors work to relax blood vessels and increase the supply of blood and oxygen to your heart. In doing so, ACE inhibitors strengthen your heart muscle and improve its pumping ability. ACE inhibitors are also used to lower blood pressure, which is helpful in people that have hypertension. Common ACE inhibitors include captopril, otherwise known as Capitan, enalapril, otherwise known as Vasotec, lisinopril, otherwise known as Zestril or Prinavil, perindopril, also known as Coversil, and ramipril, also known as Altase. Some possible side effects that people may experience when taking an ACE inhibitor include dizziness, lightheadedness, and dry cough. ACE inhibitors can affect the level of potassium in your blood, and therefore your healthcare provider will check your potassium level on a regular basis. The fifth group of medications that are used to treat coronary artery disease are called angiotensin receptor blockers, or ARBs. ARBs work very similarly to the ACE inhibitors. ARBs help to strengthen your heart muscle and treat high blood pressure. They are often used in people who might not be able to tolerate an ACE inhibitor. Some common ARBs include candesartan, also known as Atacand, irbesartan, also known as Avapro, Losartan, also known as Cozar, Telmisartan, also known as Micardis, and Valsartan, also known as Diovan. ARBs also have similar side effects to the ACE inhibitors, such as dizziness and lightheadedness, which would be the most common. ARBs can affect the level of potassium in your blood, and therefore your healthcare provider will check your potassium level on a regular basis. The final group of medications used to treat coronary artery disease are the vasodilators. The most common vasodilator is nitroglycerin. Nitroglycerin helps to widen and relax blood vessels, making it easier for blood to flow through the coronary arteries and allow more oxygen to reach your heart muscle. Nitroglycerin is available in both fast-acting and more long-acting forms. Fast-acting nitroglycerin should be used to relieve discomfort from angina. Fast-acting nitroglycerin is to be used under your tongue and is available in tablet and spray forms, whichever you prefer. It is important to know how to use your nitroglycerin properly. We recommend that if you experience angina, you should sit or lie down before you use your short-acting nitroglycerin because it may decrease your blood pressure and make you feel lightheaded. If the discomfort does not go away in a minute or two, use your nitroglycerin and note the time. If you still have angina after 5 minutes, take a second dose of nitroglycerin. If your angina is still there in another 5 minutes, take a third dose of nitroglycerin, and if symptoms persist, call 911 immediately. Nitroglycerin also comes in more long-acting forms, such as Imdur or the nitroglycerin patch. These long-acting forms are used on a daily basis rather than the short-acting nitroglycerin, which is used as needed to relieve angina. Some possible side effects that people may experience from nitroglycerin include headache, dizziness, lightheadedness, and faintness. The final group of medications that I will talk about today are the anticoagulants. Anticoagulants are also called blood thinners and are used in people to prevent clots from forming in blood vessels. Currently, warfarin, also known as Coumadin, is the most common anticoagulant used for people that aren't admitted in the hospital. Warfarin is used for many different medical reasons. Warfarin can be used in people that have had blood clots, such as a blood clot in the leg or lungs. It can also be used in certain people at risk of having a stroke, such as those who have been diagnosed with an irregular heart rhythm, a condition called atrial fibrillation. Warfarin is also used in people who have received a mechanical heart valve. Your healthcare provider will discuss with you your specific medical reason for needing warfarin. Your warfarin level needs to be closely monitored. So if you are taking warfarin, you will need to have regular blood tests called an INR. The INR blood test measures how thick or how thin your blood is. Your healthcare provider will want your INR test at a certain level or range. This level will depend on your medical reason for taking warfarin. If you are taking warfarin, it is important to know that vitamin K affects your warfarin levels. Vitamin K is contained in some foods such as green leafy vegetables, including spinach, Swiss chard, kale, in addition to broccoli and Brussels sprouts. It is recommended that these foods be consumed on a consistent basis and eating regular sized portions. No supersizing your serving of spinach. Also, dulse contains extremely high doses of vitamin K and should probably be avoided if you are taking warfarin. Warfarin can interfere with many medications, so anytime you start on a new medication, whether it is prescribed or over the counter or it is a natural health product, it is extremely important to inform your healthcare provider who monitors your warfarin level of the new medication that has been added. The most common side effect seen with warfarin is abnormal bleeding. Because warfarin thins the blood, you need to watch out for any blood in your urine or stool. It is very important to report any of these symptoms to your healthcare provider monitoring your warfarin. Dabigatran, also known as Pradex, is a new type of anticoagulant that is being used in place of warfarin in some patients. It appears to be as effective as warfarin and possibly even safer, but is not appropriate for all patients. It too can cause abnormal bleeding, and any excessive bruising or blood in the urine or stool should be promptly reported to your healthcare provider. Hopefully you now see the benefits and importance in taking your medication prescribed by your healthcare team. Understanding the protection your medications provide can be one of the best ways to protect yourself against another heart attack and to reduce the risk of future blockages in your arteries. But medications can't help protect you if you don't take them. Here are a few tips that can keep you on track with your medication. Take your medication as directed by your healthcare provider. Take your medication at the same time every day. If you are having difficulty remembering to take your medication, your community pharmacist can help you with organizing your medication. Do not stop any of your medications on your own. If you are having side effects you feel are caused by your medications, please contact your healthcare provider. Contrary to popular belief, vitamins, herbal products, and other over-the-counter medications can have side effects. Make sure you talk to your community pharmacist or healthcare provider before using any over-the-counter products. And finally, remember to always keep a current list of your medications with you at all times. Thank you very much.